Hi students, we are going to continue on our conversation about substance use disorder with our second segment. Our second segment is going to be talking about tobacco use and tobacco use disorder. We're going to focus in on tobacco use next because it is the second most common substance that is abused in the United States. The primary addictive agent in tobacco is nicotine. When an individual smokes a cigarette, the nicotine stimulates the dopamine neurons, and what this causes is a reinforcing effect. In other words, it makes that person feel, oh, this feels good, I need to smoke another cigarette. So what are some prevalence and health consequences? About 18% of our population are considered smokers. Now I'm going to tell you that the rate of smoking has decreased dramatically. When we look at the rates of smoking over time, and I'm really talking about since the 1940s, we see it sort of peak out in the 50s and 60s, and in fact in 1964 about 43% of our population were considered smokers. In 2014 this is all the way down to about 18%, and it's hovered right around here for a little while now. Right about 18-20% of the population being smokers. Yet, smoking still remains the single most preventable cause of premature death in the United States. The health consequences of smoking are dramatic, they are severe, and they are preventable. Cigarettes kill about 1,100 people every day, and in this country 1 of 6 deaths is somehow related to tobacco use. Lung cancer is still the most common cancer, and about 87% of lung cancers are connected to smoking. Cigarette smoking also causes or exacerbates things like emphysema. We call this now COPD. Cancers of the larynx, esophagus, pancreas, bladder, cervix, stomach, and cardiovascular diseases. It is a habit that I tell my students you should never pick up, and if you have it, you should stop immediately. The sooner you quit, the better. As a young adult, as someone who is 18 or 19 or 20, you can quit now and almost reverse any impact that it may have had on you. The longer you wait, the harder it is. When we talk about prevalence, we know that it's more prevalent among white and Hispanic youth than African Americans. However, African Americans are less likely to quit and more likely to get lung cancer. Why that is, there's a couple different theories out there. One is that we believe African Americans just genetically seem to metabolize nicotine more slowly. They have a tendency to smoke more menthol cigarettes. This is probably partially due to the heavy advertisement of menthol cigarettes in African American communities, and those particular brand of cigarettes or type of cigarettes, they're inhaled more deeply, they're held into the lungs longer, and that may be why they're more prone to getting lung cancer. Another theory is simply that African Americans just are less likely to utilize the healthcare system. And so by the time they get diagnosed with lung cancer, it's just simply further along. We know that smoking is more prevalent among men than women, with the exception of 12 to 17-year-olds. Why is it that so many more teenage girls smoke than boys do? And one theory here is that girls at this age connect smoking with being thin and staying thin. And so they smoke in order to curb appetite and in order to stay thin. When we look at the impact of secondhand smoke, also known as ETS or environmental tobacco smoke, we know that smoking produces high levels of ammonia and carbon monoxide and tar into the air. Causes about 40,000 deaths per year in the United States. So if you are living in a household or with someone who smokes, or you're working with someone who smokes, it puts you at risk. It puts your health at risk. If a child is living in a household with an adult that smokes, it puts them and their health at risk. We know that there is some sort of connection between sudden infant death syndrome, that is children that simply stop breathing while they're sleeping. I use that term children. Really, I'm referring to infants. I'm referring to babies that are under 12 months of age, that they stop breathing while they're sleeping and they pass away. We don't know if smoking is causing that, but we do know that children or babies that live in a household with a smoker are at a higher risk for that. We know that it's connected to pregnancy complications. One thing we know is that women who smoke during pregnancy, their babies are smaller. Their babies are not giving the same level of oxygenation that women who don't smoke. And so they have a tendency to have babies that are underweight. There's some research done connecting women who smoke during pregnancy and ADD and ADHD. We seem to see higher rates of that in the children of women who were smoking while they were pregnant. In addition to that, children of smokers are more likely to suffer things like asthma and other respiratory infections, including ear infections. They're more prone to those things simply because they're living with a smoker.